watch on my wrist says noon. The clock on the wall, which is State House time, has nothing to do with legislative time. It says 5 after. I had to learn legislative time. Good afternoon. I'm Brownie Carson, state senator live in Hartsville and represent District 24, which is the coast in the Brunswick area. And I am delighted and intent as I speak to you all this afternoon, as I will be in an hour, about the need for Maine to restore our critical public health nursing service. 4, 5, 6 months ago, I knew nothing about public health nursing. Someone recommended that I read a Bangor Daily News article from August about the fact that even in the face of the opioid crisis, even in the face of the risk of infectious disease outbreak, our public health nursing service was being dismantled. I looked into it further, and I found that yes, indeed, it is being dismantled. And not only that, but it is being taken apart without any serious public conversation, no policy review, no engagement from people who really are experts in the field, two of whom you're going to hear from at this press conference, and a number of others who will be speaking at the hearing in front of the Health and Human Services Committee. 6 years ago, we had 59 public health nurses, including field nurses, managers, and planners, in 13 offices across the state who were looking after all of Maine's people. Now, although the numbers are hard to get, we think we have between 20 and 23, notwithstanding the fact that there are 48 public health nursing positions still approved in the budget. What does that mean? That means that our Department of Health and Human Services and our CDC, knowing the risks, have refused to fill public health nursing positions. So legislation that I and a number of other legislators with very strong bipartisan support are introducing would actually require the Center for Disease Control and the Department of Health and Human Services to hire back public health nurses so that we have the strength, we have the capacity to take care of Maine's people. Public health nurses do a number of things, and I'm just going to touch on several very lightly. The first thing that they do is that they safeguard the health of our public, look out for infectious diseases, they track infectious diseases, they work with hospitals and primary care providers to make sure that the people who contract an infectious disease get treated and that it doesn't spread dangerously to other people in the population. Second thing they do is that they visit, we used to visit, at the request of hospitals, primary care providers, pediatricians, young families, infants, post-hospital, in some cases, of course, get to know the families in the hospital, so that when a child leaves the hospital after birth, particularly if there's a substance abuse issue, a low birth weight issue, any kind of health issue, the nurse can be there with the other providers and for the family to make sure that that young child, that infant, gets a fair start and gets good care. And that's really critical. And finally, in addition to serving the whole population and focusing on kids and families, public health nurses go to the most rural and some of the most out-of-the-way parts of our urban area, looking on people who actually have infectious diseases, TB and others, so that they know that the medications are being taken. They know that medical protocols, as best as can be, are being followed, so that the health of those people is restored and the health of the population around them, whether urban or rural, is being protected. I'm going to stop there, and I'm going to introduce my lead co-sponsor from the House of Representatives, Ann Perry, who is a nurse practitioner from Washington County. Ann?
Thank you, and good afternoon. I actually am what we call a mandatory co-sponsor because both Senator Carson and myself introduced similar bills, and it has been great working with him for this. I represent District 104, which is in far eastern throes of Maine, in and I live in Calais. I am also a family nurse practitioner and still working as a family nurse practitioner. According to the website, the mission of the Maine Center of Disease Control and Prevention is to provide the leadership, expertise, information, and tools to assure conditions in which all Maine people can be healthy. Public health nursing plays an indispensable role in meeting the stated mission of the CDC. However, more than half of the authorized public health nurse positions remain vacant or have been discontinued. I contend that the shortage of public health nurses is already having an effect on Maine's public health. Although infant mortality has been on a steady decline nationally for years, since 2014, it has increased sharply in Maine and is now higher than the national average. It is time to do something to restore public health in Maine. This bill begins to rebuild the tools needed to meet the Maine CDC mission. Thank you.
Next, I'd like to have Roger Cates, State Senator from the Augusta area, who is a co-sponsor of the bill speak. Thank you, Roger.
Thank you. Thank you. Good afternoon. Let's look at the current environment as we decide which way to go this fork in the road. Infant mortality rates are up a lot. Drug-affected births are up a lot. Treatment-resistant tuberculosis has become more of a problem that could explode on us at any moment. The H1N1 virus is a recent reminder that a major health outbreak can always be right around the corner. The fact is, we don't know what we don't know. We don't know what the next outbreak or public crisis is. The key to getting through is to be prepared, and presently we are not prepared. We can sit idly by and watch the dismantling of our public health system, or we can begin to reconstruct it at a time when it is more important than ever. And that's why I'm so proud to be a co-sponsor of this bill. Thank you.
Thank you, Roger. We have here a resident of the Dover-Foxcroft area who would like to address the group.
Hi, my name is Dawn, and I'm from Dover-Foxcroft. I receive public health and nursing services for my 2.5-year-old son. She has been involved since the day my son came home from the hospital because he had low birth weight. She has been a tremendous help to my family. Because of her, he was able to be diagnosed with autism at 18 months. And without her, I don't know what I would have done over the last couple of years. She's meant the world to us.
Thank you, Dawn. Dervilla McCann, Dr. Dervilla McCann from Augusta.
For those of you who don't know me, I'm Dr. Dervilla McCann. I'm a cardiologist by training and recently got a master's in public health, and my current role is Chief of Population Health at Central. In that role, one of my most important jobs is finding vulnerable patient populations and providing care for them, often through outreach, always collaboratively with community service organizations, and of course, with our state government, in particular, nurses, who serve a vital and critical role, particularly outreach for the rural people who live far from hospitals and often have difficulties with transportation. It's ironic to me that we are talking about this issue now, almost 100 years to the day, from the time that Maine was absolutely rocked by the worst natural history disaster in the history of mankind, the 1918 influenza epidemic. Since that time, because of lessons that we learned, the death among our young people and the devastating halt to all normal activities in the state, we constructed a public-private partnership that has lasted for over 100 years that depends on training nurses and experts in the field of health and disease prevention. It's worked for 100 years, and we've had recent tests. You've heard heard Senator Case talk about H1N1. In 2009, H1N1 was a pandemic around the world that killed 500,000 people, and over 12,000 people were killed in the United States. In May, because of our approach, preparation, communication, and intervention, we had not one pediatric death, and children in particular are frequent victims of outbreaks, infectious disease outbreaks like influenza. Today, we have new threats around every corner. As a matter of fact, China is now experiencing its 5th epidemic with a new avian flu. In this particular case, for this particular flu, the mortality rate is 40%. 40% of the individuals who caught the flu with this particular strain of flu in China have died. It's an avian flu transmitted by birds. All of you are aware of the changing seasons, and all of you have looked up in the sky and you've seen the returning flocks of geese and ducks. We cannot control migration of our feathered friends, but we can certainly control our response to a potential lethal epidemic. It is amazing to me that at a time of a war against the opioid epidemic and impending threats from elsewhere in the world, we've chosen this time to leave the people, the citizens of Maine, completely unprotected. The citizens deserve better from a modern government. They don't deserve to be left in the same state that we were 100 years ago when this state was devastated by infection. Thank you.
Finally, I'd like to introduce Jan Morissette, who devoted 26 years of her life to Maine's public health nursing service, of which she was the director for the last 6 years. Thank you, Jan.
Good afternoon. I'm Janet Morissette. Having had a 26-year career in public health nursing, serving both as a field nurse and as a director, I recognize the importance of a public health nursing program. PHNs are on the front lines protecting the health of all users. Public health nurses provide the largest segment of the professional public health workforce in this country. PHNs are registered nurses skilled in working in and with communities to prevent disease and promote health. Whether it's visiting a new mom and baby with health needs to perform assessments, create a care plan for the family that addresses their health needs and make referrals for additional resources, or responding to emergency public health threats such as H1N1 and quickly setting up and conducting immunization clinics across the state, or preventing infectious disease outbreaks such as infectious tuberculosis. Public health nurses are skilled nurses who respond with expertise in working with individuals and communities with the ability to mobilize statewide to meet the need. Maine needs to restore public health nursing to sufficient staffing to meet the public health challenges of our serious opioid epidemic, a rising infant mortality rate, the 14th highest in the nation, and the ability to respond to emergency public health threats and infectious disease outbreaks. With the passage of LD 1108, an act to restore public health nursing services, we have the opportunity to bring public health nursing back to a nationally recognized program of excellence that is equipped to meet those needs. Thank you.
So we can do a few minutes of questions from reporters for Senator Carson or anybody else.
We would all be glad to field questions if.
What's the price tag on this? How much is it going to cost to fill those positions?
I'm hesitating to answer because you should know that 48 of the 59 positions that were filled and serving the people of Maine in 2011 are still authorized in the budget. The governor's current budget would delete 11 of those positions, but that's in a sense academic because there are, as I said, maybe somewhere between 20 and 23 public health nurses. So the real answer is difficult to tell. But if we added from 48 back to 59, that's not a big price tag. We've not seen a fiscal note yet, and I'm not sure what sort of a fiscal note will be attached.
Is your proposal saying put it back up to 59 or you go in with 48? Where do you want to go?
We want to go to 59. And the reason for that is that when Ms. Morrison, who just spoke, was the director of the Public Health Nursing Service from 2005 to 2011, It was fully nationally accredited to the highest standards. So we feel like that's a benchmark. We know that public health nursing service was serving Maine people well, and that's a benchmark that we go back to. There have been more public health nurses than that in history in the 70s and 80s, but that's the one that I think is a place to start, and where we will at least know that substance abuse, drug-affected babies, and TB patients, and the public health infrastructure has some integrity.
With the drug epidemic being mentioned as a factor in all this, where do you decide, how do you decide what gets the money, drug treatment or the public nurses?
I think the most important thing from my perspective about public health nurses is that they are there right at the beginning. In fact, many hospitals and providers will bring a public health nurse in before a baby is born. So you've got a relationship both between the public health nurse and the family, the baby and its parents, and with the providers. So the kid gets a fair start. When we go in later, I mean, I won't go into it, but if we don't take care of our kids right from ground zero, right from birth, we know there will be lots of extra costs in all kinds of things. So to get rid of our public health nursing service, or to scale it back and hollow it out the way it has been, is to be penny wise and pound foolish in the extreme.
Thank you.
Thanks, everybody.
Thank you all very much. Public